Hey everyone, and welcome back to the channel where medical science meets clarity. I am Dr. Rezaian, specialist in arthritis and rheumatology. If you've ever wondered how a butterfly rash, joint pain, and a positive ANA test fit together, today's video is for you. We're unpacking one of the most complex and fascinating autoimmune diseases, systemic lupus erythematosus, or SLE. SLE is a long-term autoimmune condition that can affect nearly every organ: skin, joints, kidneys, brain, heart, you name it. But lupus can be elusive. It's the ultimate medical shapeshifter. At the heart of lupus is an immune system that turns against the body. It produces self-targeting proteins like ANA, anti-double-stranded DNA, and anti-SM antibodies. These trigger inflammation and tissue damage. Patients may show up with joint symptoms similar to rheumatoid arthritis, a rash that worsens with sun exposure, or swelling from kidney involvement. And while these signs vary, the first clue often comes from a blood test. ANA, or anti-nuclear antibody, is positive in more than 95% of people with lupus. But here's the tricky part. ANA can also show up in healthy people, in those with viral infections, cancer, reactions to medications, and other autoimmune diseases. So what happens when ANA is positive? We dig deeper. ANA is just a starting point. From there, we move to a broader antibody panel based on symptoms. Reflex and additional antibody tests include anti-double-stranded DNA, strongly linked to lupus, especially kidney involvement; anti-Smith, classic for lupus, though rare; anti-RNP, found in overlap syndromes like mixed connective tissue disease; anti-Rho and anti-La, seen in cutaneous lupus, Sjogren's, and newborn lupus; anti-chromatin antibodies, helpful in some diagnoses; lupus anticoagulant, anticardiolipin, anti-beta-2 glycoprotein 1, all linked to antiphospholipid syndrome and blood clots; anti-topoisomerase 1, seen in systemic sclerosis; anti-centromere, common in limited scleroderma; anti-smooth muscle antibody, suggests autoimmune liver disease; anti-thyroid peroxidase, points to autoimmune thyroid disease, which often co-occurs with lupus. To confirm lupus, we follow the 2019 EULAR and ACR criteria, updated in 2023. You need a positive ANA at 180 or higher. From there, you earn points for clinical and antibody findings, like ulcers, low blood counts, protein in urine, and specific antibodies. A score of 10 or more means lupus. Let's talk about organ involvement. Lupus can hit the brain and kidneys especially hard. These are high-stakes cases that demand urgent treatment. First-line treatment for nearly every lupus patient is hydroxychloroquine. It reduces flares, protects your heart, and may even help you live longer. It does require annual eye exams for safety. Treatment depends on how serious the disease is. Lupus symptoms: joint pain, fatigue, light rashes. Treatment: NSAIDs, low-dose steroids, topical creams, plus hydroxychloroquine. Moderate lupus symptoms: ongoing arthritis, low white blood counts, inflammation around lungs or heart. Treatment: add immunosuppressants like methotrexate, azathioprine, or mycophenolate. Severe lupus symptoms: kidney failure, seizures, chest inflammation. Treatment: high-dose IV steroids like methylprednisolone, plus stronger immunosuppressants. Options include cyclophosphamide, mycophenolate, and biologics like belimumab, rituximab, or voclosporin. Once symptoms are under control, we reduce steroid doses and maintain remission with safer long-term meds like hydroxychloroquine, azathioprine, or mycophenolate. Other important points: antiphospholipid syndrome needs blood thinners. Pregnancy planning means switching to baby-safe meds. Vaccines matter. Get them before starting immune-suppressing drugs. Ongoing care includes bone scans, heart risk checks, and lab monitoring. The outlook for lupus has improved a lot. Over 90% of patients live 5 years or more, and many live long, full lives. But it takes teamwork between patient and doctor. Routine labs help us stay ahead of flares. We track white counts, kidney health, complement proteins, and antibodies, and we keep an eye out for infections. Bottom line, a positive ANA opens the door, but the full workup reveals the truth. And with early diagnosis, personalized treatment, and regular follow-up, people with lupus can absolutely thrive. If you found this helpful, tap the like button, subscribe for more autoimmune insights, and share this video with anyone who might benefit. Got a lupus question? Drop it below. We might cover it in an upcoming episode.